Have you ever noticed that your mouth feels dry all the time? Or that you're constantly tired, experiencing tingling in your feet, or waking up multiple times at night to use the bathroom without knowing why? Don't be too quick to assume it's just age. These seemingly minor symptoms could be early warning signs that your blood sugar is rising, silently but dangerously. Many people don't find out they have diabetes until the disease has already caused damage to their blood vessels, nerves, or vision. But in truth, your body often gives you early signals, if you know how to listen. In today's video, Holistic Health will walk you through 16 common signs that your blood sugar may be too high, along with 8 early symptoms of type 2 diabetes that you should never ignore. These are simple, easy-to-understand tips that can help you take control of your health and maintain your independence every day. Watch the full video and compare these signs with your own body, because early detection can change the entire course of your health future. If you find this information helpful, don't forget to like, share, and subscribe to the Holistic Health channel so we can keep walking together on your journey to a healthier, more vibrant life in your golden years. Part 1. 16 common signs that your blood sugar may be too high. 1. Frequent urination, especially at night, an early warning sign. If you don't drink much water but still wake up once or twice each night to urinate, your blood sugar may be running high. When there's excess glucose in the blood, the kidneys have to filter more, leading to frequent urination. Over time, this can cause dehydration, fatigue, and disrupted sleep. For older adults, this is an important sign that may indicate early blood sugar imbalance or prediabetes. 2. Blurred vision comes and goes. If you occasionally experience blurred vision, like a light fog in front of your eyes, especially after meals or in the evening, it could be a sign of high blood sugar, causing the lenses in your eyes to swell slightly. While not always serious at first, prolonged symptoms may lead to diabetic retinopathy, a leading cause of vision loss in people with diabetes. 3. Fatigue and difficulty concentrating. High blood sugar prevents glucose from entering your cells to produce energy. As a result, you may constantly feel tired and unable to focus, even after resting. If you often feel mentally foggy or forgetful or frequently say the wrong words, it's worth checking your blood sugar, especially if it comes with post-meal drowsiness. 4. Dry mouth. A common but often overlooked symptom. When blood sugar rises, fluids are pulled from tissues, including salivary glands, leaving your mouth dry, throat irritated, and breath bad. A persistent dry mouth increases the risk of cavities and gum disease. 5. Erectile dysfunction in men. For men over 60, a decline in sexual function shouldn't be assumed to be just aging. Chronically high blood sugar can damage small blood vessels and nerves in the genital area, making this a common but overlooked early sign of diabetes and vascular issues. 6. Frequent infections. High blood sugar weakens the immune system and provides an ideal environment for bacteria and fungi. Repeated skin infections, urinary tract infections, gum infections, or genital yeast infections may point to blood sugar issues. If infections recur or don't fully resolve, get your glucose levels checked. 7. Slow healing wounds. When blood sugar is elevated, circulation is impaired, making it harder for nutrients to reach injured tissues. As a result, small cuts, insect bites, or scrapes, especially on the feet or hands, can take much longer to heal. This is an early warning sign of diabetes-related complications. 8. Bloating, indigestion, or nausea. High blood sugar can disrupt the nerves that control digestion, causing delayed stomach emptying. You may feel bloated for hours after eating, experience gas, nausea, abdominal discomfort, or even vomit undigested food. Over time, this impairs nutrient absorption and weakens the body. 9. Persistent fatigue without clear cause. If you feel drained, sluggish, short of breath, or need more sleep than usual, even with little exertion, it may be because your body isn't using glucose efficiently due to insulin resistance or deficiency, common in type 2, diabetes, or prediabetes. 10th, constant thirst, one of the hallmark signs. When blood sugar is too high, The kidneys increase urine output to flush out excess glucose, leading to dehydration and persistent thirst, even shortly after drinking water. 11. Itchy, dry skin, especially on the legs. High blood sugar reduces circulation and dries out the skin, especially on the shins. If your skin feels rough, flaky, or itchy and doesn't improve with lotion, high blood sugar may be the cause. 12. Frequent hunger shortly after meals. Prolonged or early return of hunger can result from the body not using glucose efficiently, making the brain and muscles feel energy deprived. This is also a classic sign of insulin resistance. 13. Belly fat or visceral fat gain. If your waistline increases despite no change in diet, long-term insulin resistance may be to blame. The body stores excess glucose as fat, especially around the lower belly, thighs, and hips. 14. Nerve pain or tingling in hands or feet, pins and needles sensations, or dull pain in calves or ankles are early signs of peripheral nerve damage caused by high blood sugar. Left untreated, this may lead to irreversible neuropathy. 15. Unusual skin darkening. Darkened, thickened, or rough skin around the neck, armpits, or elbows, known as acanthosis nigricans, is a classic indicator of insulin resistance and a potential warning sign of type 2 diabetes. 16. Frequent tingling or numbness. This symptom becomes more concerning when paired with muscle weakness, leg fatigue, or reduced foot sensitivity. It often signals early-stage diabetic neuropathy, progressing quietly over time due to prolonged high blood sugar. Part 2. 8 early symptoms of type 2 diabetes. In addition to signs of high blood sugar, there are specific early symptoms that may indicate you've entered the stage of prediabetes or type 2 diabetes. Recognizing them early allows timely intervention and helps prevent serious long-term complications. 1. Constant fatigue and hunger. Even though you're eating regularly, you still feel tired, hungry soon after meals, and lack energy. This is due to insulin resistance. When insulin doesn't work properly, glucose cannot enter the cells to produce energy. Your body feels starved from within, even though you're eating enough. 2. Frequent urination. One of the most common signs. When blood sugar is too high, the kidneys have to work overtime to eliminate excess glucose through urine. This leads to frequent urination throughout the day, including nighttime, which disrupts sleep and causes fatigue. 3. Unexplained weight loss. If you're losing weight quickly without dieting, pay attention. When glucose can't enter cells, the body starts breaking down fat and muscle for energy, leading to unintentional weight loss. Frequent urination also causes the body to lose calories and essential nutrients. 4. Dry mouth and constant thirst. Frequent urination leads to dehydration. Your body responds with a dry mouth and persistent thirst. You may feel like your throat is always dry and that drinking water doesn't relieve it. 5. Blurry vision that comes and goes. Fluctuating blood sugar can change fluid levels in the eyes and temporarily swell the lenses. This causes blurry vision, difficulty reading, or seeing fine print. If left uncontrolled, it can lead to diabetic retinopathy, one of the leading causes of permanent vision loss. 6. Slow healing wounds. If small cuts, insect bites, or burns heal more slowly than usual, it may be due to damage to blood vessels and nerves from high blood sugar. This impairs blood flow and reduces your body's ability to repair itself. 7. Tingling or numbness in hands and feet. Tingling, mild numbness, or pins and needles. Sensations in the fingers or toes are early signs of diabetic neuropathy. If not treated, this condition can progress to affect the calves, soles, and even your ability to move comfortably. 8. Darkened skin on the neck, armpits, or elbows. If you notice patches of skin becoming darker, thicker, or velvety around the neck, armpits, or elbows, it may be a sign of acanthosis nigricans, a common indicator of insulin resistance that often appears before diabetes is officially diagnosed. Dear friend, we've just reviewed 16 common signs of high blood sugar and 8 early symptoms of diabetes. These are not just medical facts. They are warning signs your body is quietly, yet persistently, trying to send you, giving you a chance to take action before it's too late. According to the Centers for Disease Control and Prevention, CDC, over 30 million Americans are currently living with diabetes, and nearly 7 million of them don't even know it. That means 1 in every 10 people has diabetes, and 2 out of those 10 are undiagnosed. Even more concerning, about 88 million people, that's 1 in 3 U.S. adults, are living with prediabetes, and most are completely unaware. These numbers aren't just statistics. They represent real families, where health, independence, and quality of life are at risk every single day. The truth is, diabetes and prediabetes don't strike like a sudden storm. They don't bring you down overnight. They creep in slowly, silently wearing down your body week after week, month after month, year after year. The early signs are easy to overlook. A little dry mouth, frequent nighttime urination, tingling in your feet, blurry vision, unusual hunger. All of these are often dismissed as just aging, fatigue, or hormonal changes. But it's that very complacency that's most dangerous. When high blood sugar is left unchecked, it does more than make you feel tired. It silently damages small blood vessels, nerves, and vital organs. You might start to feel strange pain in your legs, tingling like pins and needles in your feet. Your vision becomes increasingly blurry, and small wounds take weeks to heal. If left untreated, you could face serious complications like blindness, kidney failure, amputation from infection, or even stroke due to damaged blood vessels. But here's the good news. You are not powerless. You don't have to wait for complications to care about your health. You can take action starting today. First, start by listening to your body. Frequent urination, excessive thirst, unexplained weight loss, fatigue, slow healing wounds, or tingling in your hands and feet. These are all clear signs that it's time to check your blood sugar. A simple glucose test, or even better, an HbA1c test, can tell you if your levels are normal, pre-diabetic, or already in the diabetic range. Second, begin making small lifestyle changes. No need for extreme diets or intense workouts. A balanced diet, rich in vegetables, low in refined carbs, with whole foods and minimal added sugar, is a powerful first step. Just 20 to 30 minutes of walking a day, getting enough sleep, staying hydrated, and reducing stress can help your body begin to self-heal. Third, stay informed, read more, ask your doctor questions, join a support group or an online community. When you understand your body, you take back control, and you'll realize that diabetes is not the end. While it may not be curable, it is entirely manageable if you take action early and consistently. And lastly, perhaps most importantly, don't see taking care of your health as a burden. See it as a gift you give yourself, more time with your loved ones, more years of independence, and more mornings where you wake up pain-free, clear-headed, and full of life. You are not alone on this journey. Holistic Health is here to walk beside you, bringing simple, science-backed, and natural health knowledge to help you live stronger, healthier, and more independent each day. If today's content was helpful, we invite you to help spread the message by clicking like, so the algorithm knows you care about health content. Sharing this video with friends and family, especially anyone over the age of 50. Subscribing to our channel and turning on notifications so you won't miss future videos on nutrition, healthy habits, and natural health solutions. And finally, we'd love to hear from you. Which of the 16 signs did you recognize in yourself? What's your biggest motivation for change? Leave a comment below. We're here to listen to and support you. Because strong legs, a healthy heart, and a body full of energy are not just dreams. They are the result of small, smart choices made every day. Holistic Health, where wellness begins with understanding and proactive self-care. See you in the next video.